So, Dr. Dyball, it's a really pleasure to meet you again here at SLEuro. And let's start with some question about your experience in the Advanced Workshop in Coimbra that it has been held the previous month. So, what do you think about the format, about this workshop?
No, it was an absolute pleasure to attend the workshop in Coimbra. I thought it was a fantastic experience to meet like-minded rheumatologists from around the world. The format was particularly good in that we had a visit to Professor Innes's clinic in Coimbra, so we could see best practice elsewhere, as well as comparing it and contrasting it with practice of colleagues from again around the world. I think the social aspect of it was really great, so talking over dinner with colleagues, comparing difficult cases, and also making some collaborations for future academic research.
Okay, perfect. So, does the workshop fulfilled all your expectation in regard before your leaving? So everything was fulfilled?
So all my expectations and above, actually. It was a fantastic experience, and I would recommend it to any young rheumatologist with an interest in lupus. It was, a fantastic experience.
I'm so happy to hear this. And what was, in your opinion, the most important topic that it has been held during the workshop?
Actually, something I think really close to my heart is patient-reported outcomes in lupus, and I think speaking with both colleagues and meeting some patients within Professor Innes's clinic in Coimbra, there is a real consensus, I think, that PROMs or patient-reported outcomes should be incorporated into everyday clinic, and that's something that I'm really hoping to take back to Manchester.
Well, and what do you think about the session at the hospital? What do you think about meeting the patients, the lupus patients? So you think that it has been something useful, it has been something emotional, so what do you think about it?
Absolutely, it's a real privilege to meet the patients in Coimbra. I think I could see very clearly what a wonderful experience they had locally at the lupus clinic, and I think it really shows the heterogeneity of our patients and the difference in presentations. I think seeing the satisfaction of the infusion units and just being able to compare that to our own kind of practice with the nurses in Coimbra, in the UK particularly.
Okay, and about the workshop, this is the last question. What do you have a suggestion? I know that is a difficult one, but I guess that you have, of course, some interesting suggestion for our future workshops.
Yes, I think that's a really, really difficult question. I think one thing that was useful was going through some of the difficult manifestations in lupus that we struggle to treat. So speaking about things like fatigue, CNS lupus. So I think kind of focusing on those really core, difficult topics that we, all struggle to manage every day in clinic. I think going through those and being able to discuss it with colleagues, I think that's a key priority moving forward.
Okay, thank you very much, Dr. Dyball. You want to say something to SLEuro board members or the professors that you have met?
Well, thank you so much for organising such a wonderful weekend. It was great to meet everyone, both colleagues and professors. So thank you.
Perfect, thank you too.